I'm delighted and honoured to be part of the research team who supports the Early Career Researcher Forum, and to introduce the abstract presentations here. We have 3 oral presenters. It's a very quick fire round. They're 4-minute presentations. We're going to have time for maybe 1, and if they're short, maybe 2 questions. So I'm going to, without further ado, I'm going to introduce our first speaker. Yvonne Muldowney is in the 3rd year of her PhD programme in Trinity College, and she's a member of the ECRF, and she's also a member of the ECRF Steering Committee. Yvonne, if you'd like to. Thank you.
Did you know that only 14% of those that require palliative care are actually in receipt of palliative care? Well, my PhD study is about increasing access to palliative care for those in Irish ICUs. It's a pre-post intervention study, and it's the first of its kind in Ireland looking at a structured approach to palliative care in ICU. So I'm delighted to be here today to present to you the findings of the pre-intervention stage, the needs analysis. This investigated the current palliative care practices and needs of palliative care in Irish ICUs. And I did this by undertaking a pre-focus group and interviews and a pre-audit. So I'm going to present to you over the next couple of minutes the findings from these processes. I will finish on the next steps for this study, but I'll start by giving a brief overview to the context. So, for over a decade now, research has consistently shown that patients in ICU have unmet needs. You can clearly read from the slide. Additionally, ICU is increasingly dealing with sicker patients, an older population, and those with cancer. And this has resulted in these patients having unmet palliative care needs, and indeed having needs post-ICU as ICU survivors. So there's a need for continuity of palliative care from ICU to ward to home. Despite this, though, palliative care practices in Irish ICUs are, for the most part, not well known. There are efficacious interventions available that integrate palliative care into ICU, but they're mostly based in the USA. There is one approach that's been used in Ireland in the ED department of St. Vincent's Hospital called the PALMED approach, and this approach has successfully integrated palliative care into the ED. So my study is looking at adapting this approach based on these findings for the ICU environment. So moving on to the findings and starting with the audit. This audit was done over a 3-month period, extracting data for all patients admitted to ICU. So there was 132 patients that was admitted over this time frame. I suppose what's important to note from the key characteristics is that nearly 70% of patients were over 60 years old, and there was a 37% mortality. And just to hit on that equal gender, there was actually more or less equal male and females in this 132 patients. One of the key findings from the audit was limited access to specialist palliative care. Only 5% of those 132 patients were referred to specialist palliative care, of whom 90% died. But even more interestingly, of those 95% that didn't have access to specialist palliative care, 35% died. So this large number of people dying without specialist palliative care indicates there is an unmet need here. Additionally, across most of the key performance indicators, in fact all except for pain management, there was low rate of performance indicators, measures. Moving on to focus groups. 4 focus groups were undertaken and 3 interviews. The experience ranged from 5 years up to 20 and beyond. There was an ICU consultant, 2 senior ICU nurses that were in charge of the unit, and a specialist ICU nurse. And these findings confirmed the limited access to specialist palliative care. To put it in their own words, we rarely, if ever, provide palliative care outside of end-of-life care. Other needs identified, palliative care was very much varied and fragmented and depended on what ICU consultant was in charge on the day and what level of experience or what previous experience the ICU nurse had in relation to palliative care. They also identified educational needs where the lack of experience and knowledge was very much a strong theme that came through, and better collaborations, particularly with the specialist palliative care team and social workers, was identified. So to line this up to meet these needs in relation to the palliative approach that we're going to adapt, we can very much see from this slide that the PAL approach very much is aligned with meeting these needs. For example, if you look in red there, the access to specialist palliative care, the trigger criteria is an evidence-based criteria that identifies patients that have palliative care needs, and it's evidence-based for ICU as well, just in the USA, that will increase access to patients for palliative care early alongside treatment. The proactive palliative care engagement component of the PALMED approach also helps to increase interdisciplinary collaborations with the specialist palliative care team and social workers. In relation to various practices, the structural referral process does help hit that, but it's also recommended that it's extended for daily embedded practices, and so the general skills of palliative care is hit and meeting those key performance indicators. For example, providing social worker by day 3, offering spiritual support by day 3, and holding a family interdisciplinary meeting with goals of care discussions by day 5. It's also recommended that Nurse Champions is integrated to drive this, because it's a huge culture change for ICU and to role model. So just to finish up then, the next steps. The next steps is currently underway. These findings have been presented to the ICU clinicians and palliative care team, and we're currently looking at an implementation plan for this adapted intervention. And hopefully then the results will result in a standardised approach to palliative care in the Irish ICU to improve both patient and family experience. So thank you all for listening.
So our second speaker is Kasia Paternoska, and she is a research nurse in Marie Curie, Northern Ireland, and she's a member of the Early Career Researcher Forum and is acting chair of the ECRF Steering Committee. So Kasia, if you'd like to go ahead.
Thank you. It's amazing to see real people, actually, not the screens, so yes. So this short presentation is about the role of the research nurse in building cooperation between clinical and academic settings in palliative care charity Marie Curie in Northern Ireland. And I chose this picture because in last year when this role was created, I jumped in, happily went into unknown, really have no idea what I was getting into myself, but it has been absolutely incredible journey. So traditionally, research nurses were involved in clinical trials, particularly around recruitment to the clinical trials. However, recently the role has been expanding into other areas of healthcare research. I'm supporting recruitment, I have been supporting recruitment to several different projects over last year and this year. For example, into some of them focusing on loneliness, people with terminal illness and their carers, hospice discharge letters, deathbed phenomena, virtual reality, used in exercise program to support people with Parkinson's disease. But from the very beginning, there was one important difference. I wasn't just supporting other researchers, I am a nurse researcher. I've been developing and leading on my own research program, looking at the needs of the healthcare assistants, support needs and educational needs who are lone workers and delivering palliative care in the community. So this research has been based on the research gap that I have identified from my research practice. However, each program of research that I'm supporting, each project that is coming to Marie Curie brings new collaborations, new opportunities, new methodology, and mentorship was absolutely vital to my role to develop, and I'm confident in what I'm doing. And I would like to express my absolute big thanks to, especially for Dr. Tracy McConnell, who is here with me, who has been incredible over the last year or so, but also Dr. Felicity Hassan and Dr. Emma Cardiff, who are also my mentors. Linking with other research nurses in Marie Curie has been vital. It offered space for reflection about opportunities and challenges of the role, and vital peer support. And lastly, availability of training and education, which developed me as a nurse researcher and as a more competent and confident person. And finally, and most importantly, there are multiple benefits from having a research nurse role embedded within a palliative care charity. So for service users, I don't need to say much about that, but because, for example, when researchers are not healthcare professionals, I can support them as a skilled communicator and clinically competent person. For management and practitioners, having someone who actually have dedicated time for research, who can keep research on the agenda of busy practitioners, who can maybe remove some of the burden, of the administrative burden of the research. But also help to develop research culture, evidence-based practice, and so on. Sometimes simply by helping to write an abstract for a busy practitioner. For the nurse, amazing development opportunity. But for academics and researchers, it offers easier access to service users. We know it's quite difficult. There's quite a bit of gatekeeping between to get to the service users, but also unique understanding of the needs of both academia and practice, and unique critical voice in relating to the practice issues at the study development phase. So, in summary, the role is important asset and something to be considered, as it has a value in bridging the gap between academia and practice, between research and clinical practice. Thank you.
So our third and final speaker today is Nipuna Thamanam, and she's a PhD student in the School of Nursing, Psychotherapy and Community Health in DCU. And Nipuna is a member of the All Ireland Institute Hospice of Palliative Care, ECRF, and I'm delighted to welcome you. Thank you.
Thank you so much. It's absolute delight and pleasure to be here to present my research. Regardless of how people are born, we all eventually die. Death is such a painful experience, not only for the person who is experiencing death, but also for the family and the relatives. My story, I want to start my research by telling you just a little bit of my personal story. I'm a nurse from India, and I came to look after patients here in Ireland. I was asked to care for a person who was dying, and a colleague of mine took me to inside the patient's room to help the patient provide death care. And as I walked into the room, the nurse immediately opened the window, and we provided death care to the person. And as we walked out, she laid the Bible and the rosary beads, and she lit a candle beside the bed. And what shocked me was that when I was walking out of the room, there was a family room, and the patients were having tea and sandwiches. And I said, why are the people eating, having tea? It was a bit strange to me, because I come from a culture when somebody dies, food is the last thing that somebody would touch. And that sparked my interest to undertake this research. Internationally, there seems to be a lack of knowledge and education in respect to culture. And my study is about finding out the knowledge levels of undergraduate students, because students are the future nurses who will be taking care of people, not only people of one culture, but multicultural. And as Ireland is growing multiculturally, we are going to care for people of all different cultures. So I've seen that there is no tool in Ireland which measures the religious death ritual. So I have developed a tool and tested the tool, and that was my story. And basing on Campina Bacot cultural framework model, that is, it says the delivery of high-quality nursing care is dependent upon knowledgeable and skilled nurses, and ensuring adequate knowledge about death rituals of different religions are crucial educational aspects when preparing undergraduate nursing students to respond adequately to multicultural and diverse complexities of care. Campina Bacot cultural framework tells us that every nurse, to be a competent nurse, should have cultural awareness, she should have knowledge, attitude, and skills. So I'm starting my research with the basic one, to measure undergraduate student nurses' knowledge. So my objective of the study is to develop and psychometrically test the validity and reliability of the tool to measure the undergraduate students' knowledge of 3 world religions, that is Christianity, Islam, and Hinduism in the Republic of Ireland. So these are the 3 different religions. You can clearly see the pictures and how different the cultures are. So the design as a quantitative survey instrument was developed, and its validity and reliability was tested. I have used 2 phases. That is, first one is the designing of the questionnaire and testing of the questionnaire. In designing of the questionnaire, I have done an extensive literature review and contacted experts within the religions, and then got a pool of questions, and then the questionnaire was then tested with 6 experts. The results are, we have done a reliability testing as well on undergraduate students of 68. Convex alpha coefficient for the entire tool was 0.74, and content validity of the tool was tested related to the content validity index, which was done for clarity and relevance. The CVI for clarity was 0.96, and for relevance it was 1. So now what am I doing with this? I am undertaking a national study to look at the knowledge levels of undergraduate students in whole of the 13 HEIs. So the limitation of this study was that it was done in one university with a small sample size, but I will be taking further analysis when I have the national study sample. So one takeaway message is we have only one chance to get it right, and I hope we all get it right. Thank you so much.
Thank you so much, Nipuna, and to our 3 presenters. Really appreciate that. Thank you.